Welcome to NCLEX Rapid Revision. In this episode, we'll cover the most important NCLEX questions on musculoskeletal injuries. A client who plays badminton frequently experiences wrist pain that worsens with movement. The healthcare provider diagnoses the client with Tenosynovitis and advises temporarily avoiding repetitive wrist motions. Which client statement indicates the best understanding of the recommended treatment? A. I should keep my wrist completely still at all times. B. I need to take a break from playing badminton until my wrist recovers. C. I can switch to playing table tennis instead. D. Wearing a snug wristband while playing will help. Before jumping to the options, let's understand the disease in question. Tenosynovitis refers to inflammation of the sheath surrounding a tendon, commonly caused by repetitive motion or overuse. This condition frequently affects the wrist, leading to pain, swelling, and restricted movement. Since continued strain worsens the condition, rest and modification of activities are essential for healing. What is the question asking for? The keyword understanding means we must select the statement that correctly reflects knowledge of proper treatment. The phrase, avoiding repetitive wrist motions, suggests that the correct answer must emphasize stopping activities that strain the wrist. To answer correctly, we must eliminate incorrect responses and choose the most appropriate statement based on medical recommendations. A. I should keep my wrist completely still at all times. While reducing movement is helpful in the short term, total immobilization is not recommended. Keeping the wrist completely still for prolonged periods can lead to stiffness, muscle weakness, and joint rigidity. Instead, once inflammation subsides, gentle movement and controlled exercises aid recovery. Since this option promotes unnecessary immobilization and the question asks for the correct statement, this option is incorrect. B. I need to take a break from playing badminton until my wrist recovers. Badminton involves repetitive wrist movements such as gripping and swinging, which increase tendon stress and worsen inflammation. Temporarily stopping the activity removes the strain, allowing the tendon to heal. Since this directly aligns with the recommended treatment and follows the principle of avoiding repetitive wrist motion, and the question asks for the correct statement, this option is correct. C. I can switch to playing table tennis instead. Although table tennis appears to be a lower impact sport, it still requires repetitive wrist motions such as gripping, rotating, and swinging, which can continue to strain the inflamed tendon. Because this option does not eliminate the repetitive motion that caused the condition and the question asks for the correct statement, this option is incorrect. D. Wearing a snug wristband while playing will help. A wristband may provide some support, but it does not prevent overuse of the tendon. If the client continues playing while wearing a wristband, repetitive strain remains, delaying healing. Since this option fails to address the need for rest and the question asks for the correct statement, it is incorrect. Before we move to the next question, let me introduce you to the perfect NCLEX review course for busy nurses. If you have very little time to prepare but still want to pass with confidence, this course is designed just for you. With an incredible 99% passing rate and over 10,000 nurses successfully passing the NCLEX in the last 5 years, this is the proven path to success. Here are the key course features that make it stand out. Enroll now and grab an exclusive 70% off. Don't miss this chance. Secure your spot today. Now, let's move on to the next question. A nurse assesses a patient who tripped while walking down a slope and is now experiencing ankle pain and swelling. While awaiting an X-ray, which nursing intervention would be most effective in reducing soft tissue swelling? A. Apply a warm compress to the ankle. B. Use a cold pack and elevate the affected area. C. Encourage gentle foot movements. D. Keep the foot stabilized. Before jumping to the options, let's understand the condition in question. Soft tissue swelling after an injury occurs due to inflammation, fluid accumulation, and increased blood flow to the affected area. The goal of early management is to reduce swelling and prevent further injury. What is the question asking for? The key phrase, most effective, means we need to prioritize the best intervention to reduce swelling. The term soft tissue swelling suggests that the correct response should align with early injury management strategies. To answer correctly, we need to eliminate interventions that do not effectively reduce swelling and select the one that aligns with best practice guidelines. A. Apply a warm compress to the ankle. Heat increases blood flow, which can worsen swelling and inflammation in the early stage of an injury. While warmth is beneficial during the later recovery phase, it is not appropriate immediately after trauma. Since this does not effectively reduce soft tissue swelling, and the question asks for the most effective intervention, this option is incorrect. B. Use a cold pack and elevate the affected area. Cold therapy, ice, helps constrict blood vessels, reducing inflammation and fluid buildup, while elevation helps drain excess fluid away from the injured site. These two strategies are part of the RICE method: rest, ice, compression, elevation, which is the gold standard for managing soft tissue injuries. Since this intervention directly reduces soft tissue swelling effectively and the question asks for the most effective intervention, this option is correct. C. Encourage gentle foot movements. Moving the foot too soon may increase pain, disrupt healing, and worsen inflammation. While controlled movements are helpful in later rehabilitation, they are not appropriate during the initial swelling phase, since this does not effectively reduce swelling in the early stage of injury, and the question asks for the most effective intervention. This option is incorrect. D. Keep the foot stabilized. Immobilization prevents further injury and reduces pain, but alone, it does not actively reduce swelling. While stabilization is important, it should be combined with cold therapy and elevation for optimal swelling. Reduction. Since this option does not fully address reducing soft tissue swelling and the question asks for the most effective intervention, this option is incorrect. Here's another must-know NCLEX question for you. A nurse is preparing to apply an elastic bandage to a patient's lower limb to manage swelling caused by a strain. Where should the nurse initiate the bandaging process? A. Just below the knee. B. Directly above the ankle. C. Over the toes, phalanges. D. At the base of the foot, metatarsals. Before moving to the options, let's understand the condition in question. Strain refers to the stretching or tearing of muscles or tendons, commonly due to overuse or excessive force. It often leads to pain, swelling, and limited movement in the affected limb. Elastic bandages are used to reduce swelling and provide support, promoting healing while preventing further injury. The bandage must be applied from the lower part of the limb upward to assist circulation. What is the question asking for? The keyword initiate means we need to determine where the wrapping should begin. The phrase to manage swelling indicates that the goal is reducing edema and improving circulation. To answer correctly, we must eliminate incorrect locations and choose the most appropriate starting point. Option A. Just below the knee. If bandaging starts just below the knee, it does not effectively push fluid away from the lower extremity, which is the primary goal. Additionally, wrapping downward from this point could trap swelling in the lower limb rather than reducing it. Since this does not follow the correct distal to proximal wrapping method and the question asks for the correct starting point, this option is incorrect. Option B, directly above the ankle. While starting near the ankle is closer to the correct technique, it does not include the foot, which can still retain swelling. Leaving the foot unwrapped may reduce the effectiveness of compression in controlling edema. Since this option does not ensure proper distal to proximal compression and the question asks for the correct starting point, this option is incorrect. Option C, over the toes, phalanges. Wrapping over the toes could impair circulation assessment, making it difficult to check for complications like capillary refill or discoloration. Best practice is to leave the toes exposed while ensuring the rest of the foot is properly compressed. Since covering the toes is not recommended in compression bandaging and the question asks for the correct starting point, this option is incorrect. Option D, at the base of the foot, metatarsals. The metatarsals form the base of the foot, and starting here ensures proper distal to proximal compression, allowing fluid to move upwards toward the body for better circulation. This technique reduces swelling effectively while keeping the toes exposed for assessment. Since this option aligns with best practices for wrapping to manage swelling, and the question asks for the correct starting point, this option is correct. Let's test your knowledge with the next question. Which bandaging technique is most appropriate when applying an elastic bandage to a client's lower extremity? A. Figure 8 technique. B. Spiral reverse technique. C. Recurrent technique. D. Spica technique. Let's understand the concept in question. Bandaging techniques are chosen based on the shape, location, and mobility of the body part being wrapped. The goal is to provide support, compression, or immobilization while ensuring proper circulation and stability. What is the question asking for? The keyword most appropriate means we need to select the best technique specifically for the lower extremity. Option A, Figure 8 technique. This method wraps the bandage in a crisscross, 8-shaped pattern, providing firm support and stability. It is mainly used for joints like the ankle or knee, ensuring flexibility while maintaining compression. However, since the question refers to the lower extremity in general, not just a joint, this is not the best choice. Since the question asks for the most appropriate technique for the lower extremity, this option is incorrect. Option B, Spiral reverse technique. The spiral reverse method is ideal for cone-shaped body parts like the leg or thigh, as it allows the bandage to conform snugly to the natural contours of the limb. The reverse folds prevent gaps and ensure even compression, making it the most effective method for lower extremity bandaging. Since this technique provides the best support and coverage for the lower extremity, and the question asks for the most appropriate technique, this option is correct. Option C, Recurrent technique. This technique involves folding the bandage back and forth over a distal part, making it useful for covering amputated stumps, fingers, or the head. Since this method is not suitable for securing an elastic bandage on the lower extremity, and the question asks for the most appropriate technique, this option is incorrect. Option D, Spica technique. A spica wrap is a modification of the Figure 8 technique, typically used for securing dressings around a joint or extending support to an adjacent body part, e.g., hip and thigh, thumb, and wrist. Since this technique is not the best choice for general lower extremity bandaging, and the question asks for the most appropriate technique, this option is incorrect. Let's dive into the next question. Before the client is discharged from the urgent care center, the nurse provides home care instructions for managing a wrist sprain. When should the client be advised to reapply the elastic bandage for optimal support and circulation? Option A, when the fingers have a normal color. Option B, when mild discomfort is present. Option C, when swelling is observed in the fingers. Option D, when there is a sensation of joint stiffness. Let's understand the condition and question. A wrist sprain occurs when ligaments in the wrist are stretched or torn, usually due to sudden twisting or impact. Common symptoms include pain, swelling, bruising, and limited movement. Treatment often involves rest, ice, compression, and elevation. Rice therapy to reduce swelling and promote healing. What is the question asking for? The phrase, "When should the client reapply?" implies that we need to identify a sign that indicates the bandage needs to be adjusted. Option A, when the fingers have a normal color. Normal finger color indicates adequate circulation, meaning the bandage is not too tight and does not need to be reapplied. Since the purpose of rewrapping is to address restricted blood flow or discomfort, there is no need for adjustment in this case. Because the question asks when reapplication is needed and this option does not indicate a problem, this option is incorrect. Option B, when mild discomfort is present. Mild discomfort is expected after a wrist sprain due to inflammation and minor swelling. While excessive pain might indicate a problem, minor discomfort alone is not a clear sign that the bandage needs to be reapplied. Since mild discomfort does not necessarily mean poor circulation or improper compression, and the question asks for the correct indication for rewrapping, this option is incorrect. Option C, when swelling is observed in the fingers. Swelling in the fingers can indicate that the bandage is too tight, restricting venous return and lymphatic drainage. This could lead to further complications such as numbness, tingling, or tissue damage. Reapplying the bandage with proper tension helps restore circulation while still providing support. Since this directly addresses the key concern of circulation and the question asks for the correct reason to reapply the bandage, this option is correct. Option D, when there is a sensation of joint stiffness. Joint stiffness is a common side effect of immobility, particularly if the wrist remains wrapped for long periods. However, this does not necessarily mean that the bandage is too tight or circulation is compromised. Gentle movement and range of motion exercises can help reduce stiffness. Now let's tackle another important NCLEX question. A patient arrives at the emergency department after falling from a step stool, complaining of severe shoulder pain. Upon assessment, which finding would most strongly indicate a shoulder dislocation? A. The patient reports severe discomfort. B. Noticeable swelling is present around the joint. C. The patient avoids moving the affected arm. D. The injured arm appears longer than the uninjured arm. Shoulder dislocation occurs when the humeral head is displaced from its normal position within the shoulder joint, usually due to trauma. This results in pain, loss of function, swelling, and an altered arm appearance depending on the type of dislocation. What is the question asking for? The keyword most strongly indicate tells us to find the most definitive sign of shoulder dislocation, not just a general symptom. Pain, swelling, and movement restriction are common in many injuries, so we need to identify the most specific finding that strongly suggests shoulder dislocation. Since the question asks for the strongest indication, we must eliminate the general signs and select the most conclusive one. Option A. The patient reports severe discomfort. Pain is a general symptom of many musculoskeletal injuries, including fractures, sprains, and contusions. Although shoulder dislocations cause severe pain, this symptom alone does not confirm the diagnosis. Since the question requires the most definitive indicator and pain is nonspecific, this option is incorrect. Option B. Noticeable swelling is present around the joint. Swelling is a common response to tissue injury, whether from a fracture, sprain, or dislocation. While it is present in dislocations, it does not distinguish them from other injuries. Since the question asks for the strongest indication, and swelling is not unique to dislocations, this option is incorrect. Option C. The patient avoids moving the affected arm. Avoiding movement, guarding the limb, is a typical response to pain and joint instability, but it is not specific to shoulder dislocation. Other conditions like fractures, rotator cuff injuries, and nerve injuries also cause limited movement. Because this does not definitively confirm a dislocation and the question requires the most specific indicator, this option is incorrect. Option D. The injured arm appears longer than the uninjured arm. A visible length difference between the injured and uninjured arm is a hallmark sign of shoulder dislocation. This occurs because the humeral head moves out of its normal position, disrupting limb alignment. Unlike pain, swelling, or movement restriction, which are common across various injuries, this sign is highly specific to shoulder dislocation. Since the question asks for the most definitive indication, and this is a clear diagnostic feature, this option is correct. Let's dive into the next question. The nurse is preparing a client for a closed reduction procedure to treat a shoulder dislocation. When the client asks the nurse what closed reduction means, which response is the most accurate? Option A. It involves making an incision to realign the bones. Option B. It requires inserting a pin or wire into the joint for stabilization. Option C. It is a manual procedure to reposition the bone without surgery. Option D. It strengthens the joint through prescribed exercises. A shoulder dislocation occurs when the upper arm bone, humerus, is forced out of its socket in the shoulder blade. This usually happens due to trauma, sports injuries, or falls, which can cause severe pain, swelling, and restricted movement. If not treated properly, recurrent dislocations and joint instability may occur, making timely intervention crucial. Option A. It involves making an incision to realign the bones. The word closed in closed reduction is key, as it means the procedure is done without an incision. Since this option describes an open reduction, which is a surgical procedure that requires cutting into the skin and joint to realign the bones, it does not accurately define a closed reduction. Because the question is asking for the correct definition of closed reduction, and this statement describes a surgical approach instead, this option is incorrect. Option B. It requires inserting a pin or wire into the joint for stabilization. Closed reduction is a non-surgical method, meaning it does not involve internal fixation with pins or wires. These stabilizing devices are typically used in surgical procedures to secure fractured or severely displaced bones rather than in simple dislocations that can be manually corrected. Since this option incorrectly suggests the use of surgical stabilization and the question specifically asks for an accurate description of closed reduction, this option is incorrect. Option C. It is a manual procedure to reposition the bone without surgery. Closed reduction involves manually applying controlled force to return the dislocated bone to its normal position without making an incision or using surgical tools. This technique is often performed under local or general anesthesia to minimize pain and may be followed by immobilization with a sling or brace to prevent further dislocation. Because this statement correctly describes closed reduction as a non-surgical manual procedure, and the question is asking for the most accurate response, this option is correct. Option D. It strengthens the joint through prescribed exercises. Rehabilitation exercises play an essential role in recovery after a dislocation has been treated, but they are not part of the closed reduction procedure itself. The primary goal of closed reduction is to realign the joint, whereas strengthening exercises are introduced later in the healing process to prevent future dislocations and improve joint stability. Since this option describes rehabilitation rather than the actual procedure, and the question is asking for the definition of closed reduction, this option is incorrect. Thank you for watching. Stay tuned for daily NCLEX review lectures where we cover the most important high-yield topics to help you ace your exam. Don't forget to like, subscribe, and hit the notification bell so you never miss an update. See you in the next session.